An emergency meeting at the Centers for Disease Control and Prevention has ended without a verdict on Johnson & Johnson's coronavirus vaccine. An advisory panel met Wednesday to discuss cases of rare blood clots in at least 7 women. The meeting ended without a vote on new recommendations. This means the vaccine could be on hold for at least another week. There are mounting concerns this setback will fuel vaccine hesitancy, despite more than 7 million people getting the shot without complications. But top health officials argue that the pause is a, quote, positive issue because it shows, they say, the safety systems the CDC and FDA have in place are working. Meanwhile, the White House says there are enough doses of Pfizer and Moderna's vaccines to meet demand. Nearly 195 million doses have been administered throughout the U.S., and more than 76 million people are now fully vaccinated. Mola Lengi has the latest.
Tonight, a CDC advisory committee saying they need more time to assess data and risks on the Johnson & Johnson vaccine, and they expect the CDC will keep the pause for now. After 6 cases of blood clots were reported in women, all aged between 18 and 48.
Right now, we believe these events to be extremely rare, but we are also not yet certain. We have heard about all possible cases.
And now we're learning new details about the women. All reported headaches as a symptom. None were pregnant. Half had obesity as a pre-existing condition, and only 1 of the 6 white women was taking the hormones estrogen and progesterone. Tonight, 3 remain hospitalized, with 2 in the ICU, and we now know the woman who died was a 45-year-old from Virginia. Only 2 of the women have been released from the hospital. 4 of the 6 had received heparin, a standard treatment for blood clots, but harmful for the type of clots they had.
Because it could be dangerous and make the situation much worse.
I don't want to, put anybody at risk here.
Pharmacies and vaccine sites are scrambling, and so are Americans.
I was definitely excited to finally get it, and then just kind of got slapped in the face and say, hey, no, you have to wait again.
The pause could affect some communities more than others. Rural residents, students, and the homeless, populations the Biden administration's vaccine campaign was targeting with the J&J vaccine. More than 7 million J&J doses have already been administered, but they still account for less than 5% of the total doses given. The U.S. is now averaging 3.3 million daily doses.
I want to be clear that we have more than enough Pfizer and Moderna vaccine supply to continue or even accelerate the current pace of vaccinations.
But public health leaders acknowledge that vaccine hesitancy remains a concern.
It's going to be a hard sell for not just Johnson & Johnson, but for any vaccine.
People need to know that the system is working for them, that we're being vigilant. And even though this wasn't an easy decision, it was the right decision.
Well, here at this site outside the Miami Dolphins Stadium, about 1,600 Pfizer vaccines were administered just today. But a major concern here in Florida, as it is in most states, are those underserved communities. Many of them have been relying on the Johnson & Johnson vaccine and will likely be even further squeezed as that vaccine remains in limbo. Lana?
Mola, thank you. For more now, let's bring in Dr. Amesh Adalja. He's an infectious disease expert and senior scholar at Johns Hopkins University's Bloomberg School of Public Health. Dr. Adalja, good to have you. So the CDC met Wednesday to review those reported cases of blood clots linked to the Johnson & Johnson vaccine and ultimately adjourned without a vote or a decision. So what does this mean for the fate of the vaccine?
I don't think it's good news for this vaccine because right now that tells you that the panel wants more information, that they're not ready to lift the pause. And I think the longer that this is paused, the harder it's going to be to restart because there is vaccine hesitancy, even though this is a very rare complication and one that most people will never even have to worry about. What's going to be cemented in the mind of the public is there's something wrong with this vaccine. And when that pause is inevitably lifted at some time, you may find people just not wanting the Johnson & Johnson vaccine. And it's taken many hits to its reputation throughout this pandemic as being thought of as a lesser vaccine. And now it's really going to be relegated to second-class status. And I think that's unfortunate because this is a safe and efficacious vaccine.
Well, as you say, there are concerns that this pause and these headlines will fuel vaccine hesitancy, particularly in terms of the Johnson & Johnson vaccine and potentially across the spectrum. But Dr. Anthony Fauci said on Wednesday that the quick response to the Johnson & Johnson events should be seen as a, quote, positive issue. How confident are you in the vaccines available and in the Johnson & Johnson vaccine? And given what you're saying, how do we reassure people who may not share that same sense of security that you have?
I'm extremely confident in these vaccines. There is real-world data just to show how effective they are. If you walk through hospitals now, you can see hospitals are not worried about capacity the way they were just back in December and January. We're seeing in countries that have highly vaccinated populations like Israel, cases plummeting. This is the path to normalcy. These are highly safe and highly efficacious vaccines. I do think that this is an example of the system working well, that they caught something that was so rare, and that's important. I think that there might have been better ways to do this. We might not necessarily had to have had a blanket pause, maybe a pause for certain risk factor groups, for example, women of childbearing age, or we could have notified everybody, talked to healthcare providers, given healthcare providers letters and guidance on how to handle these clots and how to recognize them without really causing all of this consternation over the vaccine. I'm just worried that this is going to exacerbate vaccine hesitancy and bleed into the Pfizer and Moderna vaccines, and we're going to have a lot harder time trying to convince people to get vaccinated because of what happened here. I think we're going to have to try to do it. We're going to have to meet people where they are and answer their questions. But I think it is something that is going to become more of a challenge as we become less supply constrained with the vaccine and much more demand constrained as we go into the mass vaccination phase of this pandemic.
And Dr. Adalja, as you say, there were potentially other options available, but the members of this panel ultimately decided to take this action, to make this pause, and then decided that they couldn't issue a decision on it, saying that they didn't have enough information. So what are some of the questions that still need to be answered?
First of all, we want to know, how common is this? There's 6 cases that's been reported. There looks like there was 1 in a clinical trial that occurred as well. So we want to know, are these all the cases? Are there more out there? So now we've alerted clinicians, so people will start looking. That will help understand the denominator, how big of a problem this is, as well as the numerator. And then also we want to look at these 6 women and understand, is it really something that's restricted to females? Are there any risk factors? Are there any hints that we can come at to be able to think about this? Then we want to say, what do we do for it? What's the policy? Should we then think about restricting this to certain groups, the way they've done with the AstraZeneca vaccine in parts of Europe and England? All of that's going to be really important. And I think there's a lot of questions that need to be answered, but I think what remains the same is that this is a safe and efficacious vaccine. This side effect shouldn't derail its use. It really just needs to be put into context of how uncommon this is and how the risk-benefit ratio and calculation still favors this vaccine, because we're in the midst of a pandemic with people dying every day.
So a little bit more than 23% of the population has been fully vaccinated so far. And the Biden administration says that they do not expect that this Johnson & Johnson pause will impact the timeline of the nation's vaccination program. But surely even temporarily losing out on one of the 3 vaccines, especially the one that is a one-shot vaccine, still impacts availability. It impacts the timeline, especially if this pause lasts longer than a week. So what effect do you expect that this may have on our return to normalcy if this vaccine remains paused for an extended period or is pulled altogether?
Fortunately, we have the Pfizer and Moderna vaccines, and their supply is being ramped up, and they can meet the demand of the American public. But what I'm really more worried about, as I keep saying, is that people may be less likely to get the vaccine. And even if it's the Pfizer and Moderna vaccine, which are unrelated, it just might add to that hesitancy, which is going to slow the pace. Definitely, we're going to have to reschedule people that were in line to get the Johnson & Johnson vaccine. This had been a vaccine that we were going to use in special populations, like individuals that are hard to reach in rural areas, because it's one shot, one and done. You don't have to store it in these extra cold temperature freezers. All of that's going to slow us down. I think we will still get to normalcy. It's just going to be a little bit rougher. It's going to be a little bit harder to combat the vaccine hesitancy movement because of it. And the point, though, is that we've really been really great at getting our high-risk populations vaccinated. So we've seen the benefit of the vaccine in hospitals. And I think that's really what gets us to the path of normalcy, is removing the ability of this virus to cause serious disease, hospitalization, and death. And we're well on our way to that. So I do think we will likely get there in the summer. It's going to be a little bit rocky to absorb this loss of the Johnson & Johnson vaccine and the vaccine hesitancy that's likely to be engendered. But I think we can do it. We have to continue to just be very proactive about this and continue to vaccinate at the fastest possible pace.
All right, Dr. Adalja, thank you.
Thank you.